We're doing blood sugar elevation tonight. Let's ID the culprit. And so these insights are once a month. Last month, I did a pre-recording for Andropause because we were trying to figure out our computer and lighting. But I really like to do them live. Although they'll be posted later on Vimeo and YouTube, I really would like to make sure that people can ask questions because as I'm going through the slide, there may be something that pops into you. Like your brain says, hey, what does that mean? And I can elaborate for you. So the privilege you get for being live with me is that you can ask me a question. It can be personal or general or about something I presented, and I am happy, very happy to go with you. So I always start with a word because God is who God is. He remains the omnipotent, and without fail, I think the Bible is the best book, my preference, because it's a roadmap that like none other. And in this particular one, I last time I was in Proverbs, this one I'm in Proverbs still because I'm reading the book of Proverbs, King Solomon's words. And it says in Proverbs 25:27, it is not good to eat much honey. He went on to say, nor is it glorious to seek one's own glory. So the second half of this verse is the one that I use when people say, why aren't you more on social media or you're out and about? It feels like tooting your own horn. So for me, I remind myself it's not good to eat much honey. So this piece of scripture speaks about overindulgence. So when we talk about blood sugar elevation today, I want you to keep this in mind that God did not say you cannot have sugar. It's the overindulgence that gets us into trouble, right? Somebody's saying amen right now. We always do the 5 principles to optimal health, and tonight we have the privilege of doing 2 particular principles. So the nervous system, a balanced nervous system is the tabletop, and then you have 4 strong legs: nervous, nourishing foods, appropriate exercise, adequate rest, relaxation, and a positive mental attitude. Tonight, when we look at blood sugar elevation, identifying how we can get into trouble with it, and then how to manage it, we're particularly, for me, I want you to particularly think about the nervous system because the nervous system controls every function in your body. And then sugar is a nourishing food for the brain, you'll see in a moment, but it's, again, you have to avoid overindulgence. Sugar is defined, and I chose and highlighted the Oxford Dictionary, which is the British dictionary. I'm a little biased to the British dictionary and the Oxford Dictionary in its British explanations or definitions because the Webster Dictionary tends to, it's more American, nice, but it tends to, I don't want to use the word simplified, but it does use definitions that aren't often complete. So it's good, but it's not good enough. So the Oxford is specific. It says it's sweet. And we'll look at what sweet means in a moment. It's a sweet substance, often in the form of a white or brown crystals, extracted from plant juices. So sugar cane and sugar beet and used in cooking or drinks. So notice this one here, a one that we can add in here is like stevia and monk fruit, not only sugar cane and not only sugar beets. Apparently there are some beets that are not sweet. I haven't met those, but or I haven't tasted those. All beets have been sweet to me. So maybe I have to find some beets that are savory. And it says that it's used in cooking or drinks. What really I would say for the Oxford Dictionary, I ought to say it can be eaten raw or you can use it cooking. The Webster's kind of says a sweet crystallizable material that consists wholly or essentially of sucrose. Not entirely true because sugar can be broken down. This is a broken down form of sugar from carbohydrates. And while glucose exists, there's fructose and glucose. So it's not quite complete. So my bias against the beautiful Webster for this particular definition, we're going to use the Oxford Dictionary. It's some sort of crystal that can be different colors. Here's a picture of the tongue. I got this picture from the New York Times. I was searching for a clinical picture with little bit more anatomy, and I could not find one to show me what I wanted. Here's the tip of the tongue. So tonight I'm drinking water. And when I when I take a sip, I really should have no taste because water is supposed to be tasteless, odorless. and colorless, which is what my water is right now. However, the tip of my tongue tingles just a little bit if you hold water in your mouth because the tip actually wants to know if did you have sweet because the in the mouth sweet foods are broken down here. So on the tip of the tongue, if it were sweet, if I'd eaten something sweet, then salivary amylase comes from the gland underneath your tongue and it will coat the tongue and start to break it. So sugar digestion starts in the mouth. A lot of other food starts down in the stomach, but sugar starts in the mouth. So it sits right at the front here. So people, I'll ask them, are you a sweet craver or a salty craver? You see where salt sits? Then there's sour. Some models will show salt on one side, sour on one side, because there are some people one side of the mouth, if you test them, it will be all sour and the other side will be salt. So this is the general model, but some people have one side salty and one side sour. So if they eat a piece of lemon on one side, they can eat tons and tons of lemon, but if they put it in the other side of their mouth, it cannot work for them. Or same thing if they eat tons of potato chips. Bitter is always back nine. Bitter back nine. This is right before you move down into the throat. And the way you remember this is golf for golfers, bitter back nine. So the rind of the lemon, which is bitter, is really good for you to just wash your lemon very well and chew it and you'll get bitter. And bitter balances out sweet. So if you're craving a lot of sweet, and you get a piece of lemon, clean lemon, make sure the rind is clean, or some lemon juice, and put it on your tongue, you will activate sour and bitter. And that will overwhelm the sweet taste, the sweet cravings. I'm already giving you a tip that's not even in my slides, but this is based on the how the tongue can operate. Umami, it's a collection of all of these. There are some people, whatever they put in their mouth, they're going to have a mixture of flavors. That's not me. I'm very specific. When I put stuff in my mouth, I can actually taste what it is. I use my nose, but I'm also tasting the food separate. And some people, it's all the same. And umami is just a mixture collection. There are some people who, because of taste and texture, regardless of what they put in their mouth, they get a blend. I don't want to have that. But it's a kaleidoscope they describe, or a clash of all flavors in their mouth. And so sometimes they have food sensitivities, texture sensitivities. And for some people, it's pleasure to have all those mixed. But I can taste separate. And so some people can taste separate. I can tell when it's too sweet, too salty, and definitely bitter and sour. Here are some names for sugar. So if you're on your phone, you want to screenshot this. If you're on your computer, you want to take a picture of this, because smack dab in the middle of the third or the second row, all the way down here is honey that was noted in the Bible in Proverbs 25:27. But look at all the names for sugar. And you know what's missing on here? Oop, stevia is not on this list. And monk fruit is not on this list. So there are many more than 75 names for sugar. So when somebody says sugar free, they could potentially name it something else by law. And I don't know why Barbados has a sugar and not Guyana. That's just wrong. We have sugar too. But I think they mean a form of cane sugar that comes from Barbados, uh, specific. But look at all the names. The one that catches people a lot is D-ribose. Yeah. So, oh, we're listed as Demerara sugar. That's Guyana. Hello, hello, hello. What's the difference between table sugar and any of the others? Or raw sugar versus rice syrup? Now, high fructose corn syrup got a really bad because during the time when Mrs. Obama was helping to clean up the foods in schools and they were concentrating on getting the high fructose corn syrup out of foods that the kids would have in school, they then flipped it and made it fruit juice concentrate. And they call it, fruit juice. But this list is extensive. And this is important because one of the things that we'll look at for blood sugar elevation, and one of the culprits is those people who are sensitive or allergic to sugar. You could be getting it and you don't know why, right? If somebody told you panela is sugar, You're not paying attention. It's in an ingredient list in your, or corn syrup is sitting in your supplement. Not so good. Ah, here's the beautiful reminder of how powerful the nervous system is. Here's a sample of a nerve cell, and this nerve cell is just a little tiny component of the entire nervous system, which is made up of the brain and the spinal cord with these cells. So the brain talks down the spinal cord, out the nerves, the cells everywhere. This is what a whole cell looks like, and all of these nerve endings will use sugar, glucose, in a moment we'll look at that, to make sure that they can operate. So that's why if a person who's diabetic, they'll talk about neuropathy because what happens is these dendrites, these little endings on the nerve will go away. So they'll get numbness and tingling, or they'll have some sort of sensation that does not feel good, that does not feel healthy for them. But this is everywhere. Every cell in the body needs sugar, and your brain uses it for all functions. It is the gasoline, water, oil mix that your car uses to power itself. Let's look at the brain for a second. A little up close. You see my yellow highlight? I was playing with my PowerPoint. The brain is made up of all these beautiful centers. Amazing. So in school, I had a year to study the brain. So we would cut into cadaver brains over and over and over. So if you came and told me that a hair on your big toe is hurting, I can tell where in the brain that nerve is in trouble and which vertebrae I need to move to release that. So for a lot of people, they're like, well, a chiropractor had to do that. Yes, we did. We did. We studied the body. We had a year cadaver study for the body, and then we had a year of brain study. So not like a neurosurgeon, because we did not stop at the nerves and just stay there. We had to go a little further to see where it went into the vertebrae so that when I move it with my hands, that's important. So here in the back, this little walnut shape is your brain stem, the one I'm going below here. And the one that I circled in yellow is called a thalamus, the top, and in the middle of the thalamus, because the thalamus is sort of like your home, the main relay system of the brain is the hypothalamus, right? The hypo below. And the hypothalamus is the main relay system of the brain. So the thalamus houses the hypothalamus below, like your basement. And in the basement of this center right there, which is right in line with your eyes, the eyes are the only part of the brain outside the skull, and the eyes come straight into the hypothalamus area. So what you see comes into this relay system. What you taste, eat comes up into this system. And then it does all of these actions that happens. So if you have pain or a headache or a migraine or a problem, then this entire system, your brain is off centered. So the signals that are being sent to the rest of your body's in trouble. See, imagine this big old sweet brain, right? It's an organ. This big old sweet brain needs glucose to work, and you have bombarded it with too much. So then systems will go haywire because it's like you filling your gas tank with too much gas. The gasoline spills out, spreads all over your car, over you, probably on the floor, damaging to the environment. But then that overflow starts a suffocation process. So a person may come in with pain to me, and I say, you've got to ease up on the sugar. You've got to back up on the sugar. And it's not just backing up on sweet foods, but starchy foods convert into sugar. And so we may have where that's how the keto diet gets its glory from, because people say, well, if I remove carbs, then I reduce inflammation in the body, but the inflammation can come from an overwhelming amount of sugar smack dab in the center of the brain, called Wernicke's area. The same place people will crave chocolate cake, alcohol, sugar, this little spot right there. Here is where we were talking. A young lady and I were talking, Pastor S. and I were talking earlier today about brain versus body sugar. See on the bottom with my pink highlights and the one up to the top? Sucrose breaks down. So sucrose is a bimolecule, two molecules. So this is the chemistry part of me. If I have any former students on here, this is Miss Boyce speaking. Welcome to chemistry class. But here's the chemistry part of what happens to sugar. So you've got sucrose, this molecule with all of these OHs, which we see in alcohol, and then it splits and becomes glucose. Do you see the shape? 1, 2, 3, 4, 5, 6. This is a hexagon shape with two OHs, one what we call a combined OH and an HO. So you've got some oxygen flying around, sorry, three OHs and then a combined OH. So it's shaped in this manner and it fits directly into the cells of the brain. So this key fits into the brain. So the brain only uses glucose. Brain sugar is glucose. Everywhere else in the body uses fructose, sucrose, glucose. It uses all three. Look at the shape of fructose. Fructose is a pentagon. Does not go to the brain, does not cross the blood-brain barrier. So if you eat copious amounts of sugar because you're thinking you're tired or you need energy, or somebody gave you a chocolate cake or somebody gave you a chocolate bar and you're desiring to just make sure that you are consuming it, the brain cannot have it. It's not going to fit. So the brain will dump all of the excess glucose that you gave it. So you eat a piece of bread, it breaks down from sucrose to sucrose, sucrose to glucose and fructose. It splits off. The body uses, the brain rather, sorry, uses glucose, whatever it does not need, it dumps out into the body. The body then has excess glucose, fructose, and sucrose to deal with the double bonds. So brain, body sugar, the brain just needs the glucose, the rest of the sugar is on the body, and we're in trouble if we overindulge. Here is a picture of the brain. This is from somebody else's picture, and I wanted it to actually show alcohol. However, clearly I need to be an artist because cocaine is one of those substances that mimics in activity in the brain just like if it's sugar. So cocaine, so imagine for a second that another brain, picture of the brain were there. The heightened green area is the hypothalamus, which is the main relay system of your body for everything that's happening, but it also controls sugar because it takes it from all the system that comes up, brings it into the hypothalamus, which sits just below where your eye is. So if you think your eye is in front of your ear, in the middle of your head, that's where the hypothalamus sits. So if somebody has pounding headache or low blood sugar levels or high blood sugar level, they may feel off, blurry vision, the mucus comes out in the side of their eye, way too much sugar. But see how the same green area lights up? Because when you have an overindulgence of cocaine or alcohol, it does the same thing. It's the same portion of the brain. Cake, ice cream, processed sugar, all of that sits here. A piece of fruit, a piece of carrot, right? Any fruit, vegetable, any food with sugar comes into the same area. Cocaine, alcohol comes into the same area. So understanding how someone can say, I have a sugar addiction, and we need to break that. It's similar to somebody having a drug addiction in this case. So just to be aware, here's the health. And this is where we're looking at the brain where we sliced down straight across the middle. Yeah, just this one here is above the eyes. That slice. So here are labs that you need to know. Super important, super important. Vitamin D needs to be within the 50s range. 50s, 60s, very good. 70s, cool. So the functional labs that they have right now with the general labs is between 30 and 100. And so if you're above 30, somebody will say, well, you're kind of normal, but that's low normal. You need to be in the 50s. Vitamin D, according to Dr. Levi, but it needs to be taken first thing in the morning. People say there's a school of thought that says you need to add it with something fat to help it digest and break down. The standard American diet has fat in it. So whenever you take your vitamin D, that first meal or so, even if it's a handful of nuts, you're going to get some fats. I don't want you running out thinking, I need to take the vitamin D and a spoon of olive oil or colive oil. I heard that from somebody. I was like, no. The molecule is so big, by the time it comes down, breaks up into the liver, and the bile duct is there with the gallbladder. There's some fat around it. By the time you have your first meal, it digests. It's breaking up in the liver, going through the liver, but it's digested in the stomach. You would have eaten something with fat in it. There are very few people who eat pure fat free. So I don't want you to panic to think. It just needs to go in first, unless you're taking thyroid medication. Synthroid, then you need to take that, wait 30 minutes to 60 minutes after before you supplement with D. So if you're looking at your lab work and your D is low, your sugar is going to be elevated. There's blood glucose, and this varies. So if your blood glucose at no at usual should vary about 70 milligrams per deciliter, if you're thinking of it, if 2 hours after you've eaten, it should stay under 140. If you're doing the glucose monitor or you're wearing a patch, it should stay on the 140. If it's surging over 140, then you're not very well controlled. If you're on medication or the way you ate too much sugar, so some people are using it and not diabetic, they're using the monitors to know where they are. When you first wake up in the morning between 70 and 99, because you've fasted overnight, if you've had good sleep, it should be well. And just before a meal, it might be 99 to 100. It may, start to climb up a little bit because the body is up and moving, and sugar that's in the cells that was sitting overnight are breaking out or coming into your bloodstream if you're testing it. After you've eaten, it should not surge over 140. That means that your insulin production is not coming out and moving the sugar where it needs to be, which is to take it through the digestive system into the small intestine. The duodenum takes it, breaks it up, and so it breaks up that sucrose all the way, breaks the molecules down. Sucrose, fine, almost final, breaks into glucose and fructose. Glucose goes to the brain. The rest of the body uses everything else. A1C, the conflict with it, and I put less than 6 because around the world, if you are seeing doctors around the world, they say less than 6 is fine. Here in America, we stress 5.4. So sometimes, for my folks who are from overseas, they're like, what? Less than 6 is okay. That's true. But in the US, we use the standard of 5.4. A1C is the person who tells on you. It is a record of your last 90 days. What have you done with your sugar intake? And that can be vegetables. You could say, I haven't had any sweets, but you've had potatoes and you've had plantains and you've had roti, well, flour and bread and all the starchy stuff that then converts. And so A1C is historic of what you've been doing. So often doctors will use it to find out if their patients are lying. And they ask you how you've been eating, how you're doing, and you're like, oh, and I've been doing good. I eat my salads. And they're like, let's get your A1C. Here is a concern. For some people, genetically, because they have a issue with their pancreas, because the pancreas sits right in front of the kidneys and behind the heart. So if you have elevated blood pressure or a kidney stone, it can make the pancreas work harder. And so sometimes the A1C number may not be recording well. So you may hear your doctor say, I'll look at it, go back to exercise and diet, and let me take this again in 90 days to cross-check, to compare. So the fact that you had one test, an A1C that's elevated, most doctors will not tell you that they believe that you're diabetic. The readings will tell you we're all pre-diabetic, but they'll say you're going into danger zone, right? Danger zone. Here are the allergy tests that I'm familiar with. There may be others, but I'm not familiar with those. So a person comes along to me and they say, and they're in my functional wellness practice, and they are like, we're having trouble with sugar or digestion or bloating or sleeping issues or itchy skin or scalp that's not healthy or hair falling. And I say, how is your sugar intake? And we do a food diary, and I see that they have a lot of fruits and vegetables on there, but they're still bloating or having bowel distress. I may ask for this. So I usually ask for a general allergy test first to see which foods are that they are maybe allergic or sensitive to. And if they lean toward the carbohydrate foods on a regular allergy test, then I'm breaking it down into these four because I want to know what happens. So earlier when we looked at the definition for sugar and I said it was plant-based, uh, that definition is not even complete because lactase, milk has some sugar in it. So there are some people who will tell me, I am dairy sensitive. And I smile because you're not dairy sensitive. Your lactase has a problem. You don't have the enzyme to break down the milk sugar. So you have a deficiency. So you eat a piece of ice cream or yogurt or a piece of cheese and your belly bloats, you're not, you don't have the enzyme or the enzyme is not working very well. And this is where people say, well, I need to take a pre or probiotic before I have something with milk or some a dairy food. And dairies are not eggs. Dairies are from cow's milk or goat milk or sheep's milk. So feta cheese, goat cheese, they're linked into the dairy. But um, this, you ought to get tested for this before considering, because people say, well, I need to detox, 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 or take, and I say, well, just sometimes you just need to get tests. This one here, they tend to the sugarcane allergen test. You can tell that very early from childhood. Kids have, there are a couple of kids who have very strong reactions from their formula. They will tell them you're allergic from the time after they come off of breast milk, or the mom eats something that has sugar and she breastfeeds the baby and the kid breaks out. Their skin is really, really inflamed. And usually doctors will go ahead and check for the sugarcane allergy test or in the baby's formula. So this one will be found very early, number one. Number two, three, and four, usually teenage and adults people will test. And it depends on how your primary doctor feels. Sometimes they'll go a little further. Sometimes they'll send you to a gastroenterologist so that the doctor can test for these. But this slide is one that you ought to take a picture of if you're concerned that you have some sugar sensitivities and you'd like to find out. Because if you're sensitive, if any of these tests come back positive for you, then your body will show as if you're diabetic. So if a person is on diabetic medication for me and it's not down regulating, like your sugar levels are not being well managed or controlled, it's possible that you have an allergy because doctors research has a supplement called glucose sugar balance. And it just as the name says, glucose sugar balance. And what it just does with the body is help you regulate sugar in the body. So if I put you on that supplement and you're still having diabetic like symptoms or reactions, I'm like, please have your doctors. And it depends on health insurance plans and all of that, who will do it. If I have to order it for you, you'd have to be under my care because I'd want to monitor you because you have to be very strict about what you're eating to make sure that you're avoiding these. Because sometimes people add them into supplements that people are taking. So you may not be ingesting it, but you're getting it somewhere else. The other thing for ladies, things that you put on your skin may have some of these inside. Some lotions may have them as an additive. So you have to be careful as well. So out of this slide, here is how you're going to manage your intake. So let me run back up to our scripture for the day. It said, it is not good to eat much honey, means do not overindulge. It is written in the Bible. It's also good not to be like self-seeking and let people talk about your glory. You don't do it for yourself. It is not good. This is King Solomon in the book of Proverbs saying, don't overindulge. You've got to manage your intake. So you know that eating like a baby when it comes to something that's not good for you is appropriate. So baby size foods, right? Small amounts. But if you don't take care of your oral health, your tongue, your teeth, your gums, roof of the mouth, back of the throat, even your saliva, when sugar comes in the mouth, it's not going to start digesting very well. If you eat too quickly or your saliva and the mouth, the teeth, your dentist is going to check and make sure that you're chewing your food well. If that mixture doesn't happen in the mouth and you clump it down into the stomach, what will happen is that this big load drops into the bloodstream. And the brain will only pick the glucose and the rest of it will go in the bloodstream and the cells overloads the pancreas. There's not enough insulin to match it. In the mouth, sugar starts to break down. So be careful, put the food in your mouth, take your time, chew, swallow, but make sure that your mouth is clean and healthy enough to break down that sugar. When you don't drink enough water, you don't let your blood be thin enough so that there's enough space between the cells. If I'm holding my book and my cup, you want to have space between the cells. If not, they stick together. Sugar just keeps holding them together. If you take water and pour it into honey, it thins the honey becomes runny. If you don't add water, then the honey gets very thick. And what happens is sugar then stays on the cells and prevents appropriate function. So there are some people who are high sugar levels are diabetic because they're dehydrated. You just don't drink enough water. And so when you go and get your A1C tested, it's a concentrated blood. And your doctor may look at you and ask you, do you drink enough water? And you're like, yes. Are you really? You should be half your body weight in ounces. Watery fruits and vegetables, your cucumbers, your nice leafy, juicy vegetables, and making sure that you are drinking like I drank hot water out of my author's cup tonight. Just plain water. Sip it. Drink your water. Drink your water. Drink your water. Check your skin. Is there bounce to your skin? Is your skin, tenting? Then you're dehydrated. Any headaches, any stiff joints, water is the great elixir. H2O. You don't have to add anything to flavor your water, but please make sure that you're getting enough water in. So what it will do, it will help keep the sugar nice and loose and thinned out and flushed out your body versus sticking and then coating the cells and then like attracts like and more sugar clumps and then you're running into trouble. If you have to have sugar, just like I talk about fresh sunlight on your skin, fresh sugar, your fruits and vegetables. When man messes with it, the body can't recognize it. And by eating your fruits and vegetables, you add in fiber. And then fiber gets to scrape it out of the body as your bowels move in peristalsis. If food isn't moving, it's going to sit. If it sits, it ferments. When it ferments, just like in your refrigerator, if you didn't package the food appropriately and it starts to go bad or in your trash can, what happens in your body, the fermentation process will then cause organs to not act appropriately, and then your sugar levels will rise. If you took wine and you sat it out, the other day somebody gave me lemonade and I put it in a cup and I walked away and forgot about it. I came back and could smell it across the room. It was fermenting. So they made fresh lemonade, but it was sat out not being refrigerated and it was already fermenting. That told me it wasn't lemons. I think they made it from something else or something else might have been in it. But why would lemon water and some sugar already start fermenting, turning into wine? So it was becoming lemon wine. Oh my gosh. But it smelled horrible to me because I knew it was a fresh lemonade. But it was literally supposed to have been lemon, sugar, water in the cup. And I just let it sit out for more than half a day without refrigerating it and ran into trouble. So same thing with your foods. Fresh as much as you can. My rule is if you cannot have it fresh, you cannot eat it all fresh. So like my watermelon this time of year, I'm freezing it. So I can blend the juice, put it in the freezer. That way I have fresh watermelon juice when I'm ready in like ice cubes. I keep my ice cube trays for that reason. So fresh to frozen, if you cannot, just keep it around fresh. And so just remember options. If you have to use honey, stevia, monk fruit, anything, adjust the taste just a little bit, just a little bit. The little containers they give you of syrup and stuff like that, way too much. Proverbs 25:27 asks us not to overindulge.